So Judy, you mentioned the Access Center. So I feel like the Access Center now, current day,
Mm-hmm.
is like the hub, right, of all this. This is where everything begins
Mm-hmm.
and where everything is farmed out. So I think, and there's a lot of people that have no clue. People are just making a call. Like most people don't know what the Access Center is. So can you explain
Yeah, sure.
what is the Access Center and talk about your team and what they do?
Yeah, I think the hub is a good way to describe us. We're sort of the first entrance into Glennon before the transport team. So the Access Center is comprised, like I said, it's all registered nurses, and their experience level. I think the combined current state of my nurses' experience is 32 years. And that's like the average, like the average. I don't think that's the average, sorry. But I'm fortunate now that they're all pediatric and neonatal trained. So that really helps in the role. They have need high triage skills because we are the ones that get that initial information. So it's not a nurse line. That's a lot in the past. That's kind of been construed as a parent could call. We could tell them whether to go to the ER or not. And that it's not that role. And we had to do some work to kind of evolve that so that they knew it was really just that outside provider. So we get calls from physician assistants, nurse practitioners, obviously MDs, calling from hospitals. It could be another SSM hospital. It could be another hospital out of the system. And the reason they're calling is, as JP brought up earlier, a lot of those hospitals aren't used to taking care of kids. And so we treat a lot of rural hospitals, small, maybe, three beds in their ER, something like that, that small. And so when a kid comes in, it's all hands on deck, and they're just not used to seeing it. And even some of our pediatricians that have gone on in the world who've done their residency at Glennon go to some of those smaller hospitals. And it is something to say that until you experience a hospital that doesn't have the resources that we have at Cardinal Glennon, it's very hard to understand. We ask for something at the drop of a hat and we get it, or we've got all the tools we need in our bags. But at those hospitals, they don't have that, so they're reaching out to us because we are the experts in that field.